Life will never be the same after a cancer diagnosis. After having a biopsy at the colposcopy clinic and an exertion to remove the abnormal cells, I was relieved to hear the cancer hadn't spread into healthy tissues. At the appointment, the doctor only did a smear test, a visual examination, and told me everything was normal. 6 months later, I went to my GP. I requested another smear test. I then received another letter to say that I had some more abnormal cells and I would need to go back to the colposcopy clinic. When we sat down, the first thing he said to me, "It's not good news." And I had cervical cancer. At the time, I was told that I would have to have a hysterectomy. Not something I thought at 38 I would have to have. It was all just a bit too much and a bit of a shock from something that I had no symptoms for. I had cancer.
I vividly remember the morning of Josie going to hospital to have her hysterectomy, and it was at the time she was about to sign the consent form that one of the consultants questioned us about the procedures that had been carried out some time before that had led Josie to being at the hospital in the first place.
I had the hysterectomy, a long recovery, but we got back to normal and got back to being a family. The cancer treatment that I received made me very sick. I was very weak. I spent a lot of my time sleeping. I couldn't eat. So all the time the family were trying to help me, there was nothing more they could do. After the treatment, I was given the all clear, and I don't think I'll ever forget that day. It was down to us now to carry on and get back to a normal family, but it left me with side effects of anxiety, panic attacks, paranoid that would the cancer come back. I wanted a better understanding of the medical care that I received and what had gone wrong. I couldn't help question whether the hysterectomy could have been avoided. That is when we was advised to contact Boyce Turner. After my solicitor started court proceedings, the hospital soon came back and admitted negligence. They said if I had treatment on the abnormal cells, then yes, I wouldn't have had to go through with the second lot of treatment and I wouldn't have had a recurrence of cancer. The hospital, accepting they made a mistake, has put a lid on a box that has been open for quite some time. It's given us a closure. As a result of the negligence claim, I now have a better understanding of my cancer and have better understanding of how the side effects and how I deal with them.